The clinic is a program where we get patients who have had surgery, and specifically surgery related to breast cancer, who have had lymph nodes removed, and we are looking at a number of different aspects, including the prevention of lymphedema. Generally, we spend the first maybe 3 or 4 appointments where we're really focusing on getting that shoulder movement whilst taking our lymphedema measures.
Lymphedema is a type of swelling that can affect different body parts. Traditionally, about 25 to 30% of patients treated for breast cancer would have chronic lifelong swelling in their arm as a result of their treatment. However, as a result of our preventative strategies and our early intervention, only 2% of our patients have been developing lymphedema since the program started. Previously, lymphedema was something that they would have to Google to find out any information about it, or else they didn't know that lymphedema even existed until they had it. So our patients have found that they have access to quality evidence-based information, and the program gives them the chance to take some control over their outcomes moving forward. They don't always have a lot of choice in terms of what surgery or chemotherapy they need to have, but this is something where they can actually make a real difference for themselves.
We have had wonderful feedback from our beautiful patients. They have all enjoyed coming to our clinic and having almost like another member of their team and someone to advocate with them and for them throughout their journey.
Our program model has now been rolled out across New South Wales in 13 local health districts. I'm most proud of the fact that this is making a huge difference to patients all over the state, and I'm so proud that Central Coast sort of developed this model, and we really have become, I guess, the benchmark that other clinics in the state mark themselves against as well.
The aim of our project was, it was initially identified, we were seeing a lot of waste, we were throwing out a lot of adrenaline, atropine, a number of medications every 6 months, just because they've got a short shelf life. The other thing that we were noticing were these medications weren't always readily available in the event of an emergency. You know, this was the way that we'd managed medications for a long period of time, so we just wanted to ask a question as to whether it was still meeting the needs of our patients and our staff across the LHD, and what we found was it wasn't. So what we did is we pulled together a project team looking at trying to reduce our waste and improve access to these medications in what are very time-sensitive, critical incidents really.
Pharmacy contacted me. They were seeing a lot of wastage within the medications that were sitting within the ward resus trolleys, so in an acute inpatient centre, but also in the medications that the ICU team were carrying to each rapid response call. Not only that, once a pack was opened, they had to be returned to pharmacy for restocking. We actually found that there was a lot of double up of medications, and in fact, a lot of the medications we were carrying to these emergencies weren't actually emergency medications. The efficiencies that we've seen is nursing staff not having to return medication boxes to pharmacies, but also the ICU rapid response team now have more accountability over their medications and what they require at each call.
I think one thing that we got out of the project that wasn't, immediately a goal of the project was the increased working relationship between pharmacy and some of the nursing staff, particularly around emergency medications. The other really good outcomes from this project is we have saved a significant amount of money over a 12-month period, roughly around $20,000. We've also seen significantly less medications wasted and thrown out, which is a great thing for the environment. We've also had feedback from staff that these medications are easily accessed, so much easier to come across. So we think it's been a really good outcome for the LHD.
Central Coast Health at Home has a few projects running, but one of our most innovative is this alternative care pathway, which incorporates people from outside calling into virtual care and triage, our aged care response team, and also our ambulance pathways.
The aged care response team is a team that responds to the 36 residential aged care facilities that are on the beautiful Central Coast. Our team is made up of an aged care nurse practitioner and registered nurses. The referrals from the residential aged care facilities come through the one point of access, which is virtual care. The referrals there are triaged and then referred on to the most appropriate team to respond.
So a lot of our work is actually virtual care based. So we're phoning a patient, we're using the most up-to-date technology to offer video calls to facilitate remote monitoring where it's applicable, to speak to the ambulance and try and do the resources on the ground rather than an expensive transfer to another facility and then having care in the hospital. So everything's focused really on the best outcome for patients, but also being mindful of both the environmental impact and the financial impact, and being ahead of the game with technology and using it to the full scope that we can.
A large number of the referrals that come through that we do go out and review at the home are avoidable hospital presentations. Patient experience is improved because the patient has been able to stay at home in their home environment where they feel safe. They have nurses there that are looking after them, that know them.
I think if we ask the team what they're most proud of, it would be the patient outcomes and the patient-centred care. So really good, solid data on the HACs being low rates, the rates of infection being low, patients and consumers being really happy at home, the feedback from families. I'm proud of the development of the team. A lot of these services I've watched grow from their infancy, and they've been very collaborative, and I'm just proud of everyone that works in them.